prone position during pregnancy is common, particularly for those who are naturally stomach sleepers? The answer is yes, it is generally safe during the early stages of pregnancy, but it becomes impractical and uncomfortable as your pregnancy progresses. Understanding the changes in your body and the safest positions for you and your baby is key to a comfortable and healthy sleep routine. 1. First trimester, weeks 1 to 12, safe and comfortable during the first trimester. Sleeping on your stomach is typically perfectly safe. Size and protection. Your baby and uterus are still very small and are well protected deep within your pelvic bones. The walls of your uterus and the cushion of amniotic fluid act as a substantial buffer, so lying on your stomach will not put harmful pressure on the fetus. Comfort. For most women, sleeping on the stomach is still comfortable at this stage, although increased breast tenderness or nausea might make it less appealing. There is no medical evidence suggesting that stomach sleeping during the first weeks causes any harm to the baby. 2. Second trimester, weeks 13 to 28, time to transition. As you enter the second trimester, your uterus begins to grow more rapidly and extends out of your pelvis, making an abdominal bump more noticeable. Growing discomfort. Around the middle of the second trimester, most women find that lying flat on their stomach becomes increasingly uncomfortable and physically challenging. The expanding belly makes it difficult to lie flat without feeling pressure. Safety transition. While sleeping on your stomach briefly is not a cause for alarm, this is generally the time when healthcare providers recommend practicing the transition to side sleeping for better long-term comfort and safety. Pillow solutions. Some stomach sleepers use special donut-shaped or cut-out pregnancy pillows to accommodate the belly, but this often becomes less practical as the pregnancy advances. 3. Third trimester, weeks 29 to 40, switching is necessary in the third trimester. Sleeping on your stomach is strongly discouraged and is likely impossible due to the significant size of your abdomen. Physical impossibility. The weight and size of the growing uterus and baby make this position extremely uncomfortable, if not physically impossible. Pressure on organs. Lying flat on your stomach can put excessive pressure on your internal organs, as well as on your back and spine, potentially causing pain and discomfort. 4. The best sleeping position. Side sleeping (SOS), sleeping for the latter half of pregnancy. Experts universally recommend the side sleeping (SOS) position, particularly sleeping on the left side. Optimal circulation. Sleeping on your side, especially the left side, allows for optimal blood flow to your heart, uterus, placenta, and baby. It helps ensure maximum delivery of blood and nutrients to the fetus. Relieving pressure. This position keeps the heavy uterus from resting on the inferior vena cava (IVC), a major vein that runs along the right side of your spine and carries blood from your lower body back to the heart. Compression of the IVC, which can happen when lying flat on the back, can potentially reduce blood flow and cause symptoms like dizziness, nausea, or shortness of breath. Kidney function. Left side sleeping also improves your kidney function, which helps manage swelling, edema, in your legs and feet. Pillow support. To make side sleeping more comfortable, use pillows. Place a pillow between your bent knees to align your hips and back, and a wedge or full body pillow under your belly for support. This helps relieve pressure on the hips and lower back. 5. Position to avoid. Lying flat on your back prohibited. While your body will naturally make sleeping on your stomach difficult, it is crucial to avoid lying flat on your back, supine position, particularly after 20 weeks of pregnancy, and certainly by the third trimester, after 28 weeks. Vena cava compression.